All right, welcome everybody to Functional Blood Chemistry Analysis, your diagnostic advantage. Hi, my name is Dr. Dicken Weatherby, and yes, that's me up there. I think I might have changed a little bit since that photograph was taken, but if you don't know what I look like, that's what I look like there. As you can probably tell, I am originally from the United Kingdom. I've been in the United States now for, gosh, almost 24 years. So a long time here in the States. I've studied, practiced, and taught functional medicine trainings and courses in Europe, Canada, the United States. I received my naturopathic medical degree from the National College of Naturopathic Medicine. It's now actually National University of Natural Medicine in Portland, Oregon. At the time, it was the oldest naturopathic medical school in the country. I did that in 1998, and I am board certified by the state of Vermont as a naturopathic physician. I'm also the author of 6 books in the field of functional diagnostics, and I've lectured to many thousands of people, probably lectured to you maybe at some point. But I'm really about introducing quick and easy systems for analyzing blood tests. That's my main focus from a new functional, nutritional, and preventative perspective. And I'm going to teach you in my training and also hopefully touching base in this presentation on some ways for you to be able to get more from the tests that you're already ordering and helping you boost your business or practice. Now, I know many of you are familiar on the call with my work. You maybe read my books, used my software, taken a training or two with me. So I'm probably preaching to the choir when I say that it still astounds me how many practitioners I talk to have really no idea what I'm talking about when I mention that there's really a ton of information buried in their patients' blood test results. So in this webinar, I'm going to cover a system of assessment techniques I call functional blood chemistry analysis. I give it the pseudonym of FBCA. And these are designed to get more functionally oriented information from a simple blood test. These are the tests that your patients are getting done by their physicians, so they may walk in with a blood test. You may also be running tests, but the blood test is the most commonly ordered test on the planet. And I'm going to teach you what you need to learn about functional blood chemistry analysis so you can transition to a more effective way of diagnosing and assessing your patients. And with my help, you won't have to spend the thousands of hours that I've done over the last 20 plus years kind of learning my skills. But before I jump into that, I want to address something that many of you might be thinking, and that's really, why should you bother? You know, you probably have a lot of information at your fingertips. You might be comfortable with the way that we do things, and you might not want to do something different, or you might not want to introduce something new into your practice. And all of that can be time consuming for you. But here's why I think you should bother. More and more people are spending their money seeing functional medicine practitioners and practitioners of complementary and alternative medicine. And most of those patients are going to test normal when using standard allopathic medical diagnostic tests. If you don't have the skills to uncover the cause of their dysfunction, then I'm afraid they're probably going to find someone down the street or someone else on the web who is going to be helping them and not you. Functional blood chemistry analysis is getting very, very popular. And with the advent of sites like Inside Tracker and Wellness Effects and Araval, your patients are getting more and more savvy about getting info from their blood tests. But what they're not getting is information on how to look at those results from a functional perspective. If you go to those websites, Inside Tracker, Wellness Effects, etc., they're still just looking at individual biomarkers and maybe prettifying up the results into a nice looking chart. But ultimately, they don't look at the trends and patterns that exist between the biomarkers from a functional perspective. And that's what I'm going to give you tonight, and that's what I've got for you in my Functional Blood Chemistry Analysis Mastery Program. So people are finding out about the latest treatment for this disease and the latest diet condition for that condition on the internet and from the most recent health book. So when a patient makes their way to your office, you're going to have to make an impression on them pretty quickly. You need to be able to stand out as a practitioner who can make a difference and not just repeat everything that they've already read on the internet. You must be able to attract patients and be able to offer the latest techniques and treatments, but you must do it cost effectively. And I think that's where functional blood chemistry analysis and the whole realm of functional diagnostic testings come in. And guess what happens when your patients have done these blood tests with their medical doctors? They get told that everything looks normal. And I think we've all had that experience maybe as patients ourselves, or have definitely had that experience when patients come into our office sort of complaining that they've had this expensive test done, but ultimately nothing's come of it. So, but one of the things we have to remember is that the majority of patients who feel unwell will come out normal on a lot of the standard tests physicians are using. Now, clinical experience suggests that these people are by no means normal and are really a far cry from being functionally optimal. And that's what we're after. We're after functionally optimal. They may not yet have progressed to a known disease state, but they are what we call dysfunctional. And by that, I mean their physiological systems are no longer functioning the way that they evolved to function. So let's take a look at some of the typical functional problems patients are presenting to the clinic with. I'm sure you've seen many of these. It's really common for practitioners of functional medicine to have patients with symptoms such as fatigue, low energy, reduced immunity, unexplained weight gain, digestive dysfunctions, allergies, anxiety, depression, hormonal dysfunctions. These are the typical symptoms of a functional disturbance in the body. So most patients with these symptoms are presenting without clinical findings. Their blood tests, their pathology reports, they all tend to appear within quote-unquote normal range. However, with a functional analysis of a patient's blood test results, we can identify the cause of these functional disturbances before severe damage can set in, allowing you to bring the body back into a state of optimal health. So how do we go about assessing patients who present with these kind of symptoms? Well, I believe the answer lies with functional blood chemistry analysis. So what is FBCA? Well, the main focus of functional blood chemistry analysis is to provide you, the practitioner, with an organized system to assess the underlying cause of the many dysfunctions that your patients suffer from, using information gathered from a series of blood biomarkers that your patients may have already had taken by their doctor, or you can order for your patients to have run. With blood test in hand and an understanding of the functional interpretation of the results, you can analyze the blood biomarkers from a functional perspective. You're going to be able to detect early stages of dysfunction and early detection of chronic conditions related to almost every functional system in the body. And with that information, you can better prepare and implement an individualized treatment protocol for your patient. One of the things I like to say is FBCA is patient-focused, not disease-focused. For instance, you have a patient that might come in with a diagnosis of rheumatoid arthritis, but ultimately, you're not really treating a patient with rheumatoid arthritis. You're using the functional analysis of their blood tests and other functional testing that you might do to assess for the weaknesses and imbalances in this patient's physiology to try and understand why they might be manifesting with symptoms of rheumatoid arthritis. You are discovering and correcting the underlying cause of a disease process or dysfunction so that the body can return to a state of optimal health and wellness. And I believe that functional blood chemistry analysis really does this for you. However, in order for this system to work in your clinic, it must be clinically effective, easily implemented, have a high degree of patient compliance, and be financially rewarding for you. I believe functional blood chemistry analysis is such a system. But before I dive right into FBCA, I want to introduce you to 4 essential questions that I've been asking myself ever since I started on my road down to studying naturopathic medicine in 1994. I'm going to introduce you to 12 organ systems that make up the functional diagnostic hierarchy, and we'll look at these through the lenses of functional systems and that type of thing. So let's get started. Let's look at these 4 essential questions. So the first question is a very important one. It's called, is there a dysfunction in the patient, and if so, where it is? Well, we can presume that if a patient is coming to see you, that there's a problem that needs to be solved. Sadly, we don't get many people coming to us in a state of true health and wellness, asking to us, how do I remain healthy? I'd love to have that patient who comes in and goes, you know what, I'm feeling really, really good. How do I stay that way? Well, the important part of this first question is identifying the location of dysfunction. And functional blood chemistry analysis is a great entry-level test to be able to answer that question. And I think it's actually one of the best ways to get that initial hit of where to focus one's attention. And then further that, you can do further testing. Once you've answered that question, you go on to the second question. What are the sources or causes? Functional blood chemistry comes into its own in this area. It really allows you to uncover the true cause of a person's dysfunction, which allows you to put together a treatment protocol that is unique to the patient and truly individualized. So by using some of the techniques that we'll cover a little bit today, and I'll show you, but also in the training program and in the software program that I have, you're going to be able to look at the results of a functional blood chemistry analysis and identify, what's going on, which organ system is the most prevalent, what's causing this problem. And then ultimately, you can then make a decision as to which outsource labs might be used to do further analysis. And this is called gateway testing, something that I picked up from Dr. Jonathan Wright at the Tahoma Clinic in Washington. He talked about gateway testing. And functional blood chemistry analysis as that entry-level test is truly a wonderful gateway test. Third question, what individualized treatments are needed? For those of you that might have done some of my trainings in the past, I don't talk a lot about treatments because I presume that the majority of you who come to my training programs have some understanding of protocols and treatment methodologies. The nutraceutical companies that work with us as practitioners have far more information about protocols. But this is an important question to ask. Individualized treatments. And I think functional blood chemistry analysis and my functional blood chemistry analysis software actually provides protocols from some of the main nutraceutical companies, allows us to get to the unique cause of our patient's dysfunction. So we can put together that individualized treatment protocol. And then the final question, when has function been restored? And I'm amazed at the number of practitioners who don't really ask themselves this question. You must know when your patients have reached a state of function so that you can graduate them from what I call condition care to maintenance care. And this is something that I talk about in the training program. The difference between condition care and the difference between maintenance care and transitioning people from one to the other. Unfortunately, and this may be your experience too, many patients self-select when they're done, and usually it's determined by when they run out of money. What's really underneath this question is that we must be prepared to retest. I'm amazed at the number of practitioners who go out there and order $3,000-$4,000 worth of testing on their patients. Run a protocol based upon that, but never actually retest. So they're just using symptoms and signs that they pick up in order to be able to tell whether or not they've recovered function. With the functional blood chemistry analysis techniques I teach and use, this is essential because you can rerun a blood test very simply. You can either rerun the entire panel and see what's changing, and that's the great thing also about software, is that we can actually compare the results that they had done 3 months ago with the results that they've had done now, and we can see whether or not there's been change. You can get a comprehensive panel from Ulta Blood Tests, Ulta Lab Tests, who's the lab partner of ODX Academy. I talk about them in my training a little bit, some of the panels that we put together. You can run a really inexpensive blood test panel with them and do a repeat test very effectively and efficiently. So those are the 4 questions we need to ask ourselves about each and every one of our patients. In this next section, I'm going to be talking about the functional systems of the body. This is what I call kind of the functional hierarchy concept. One of the things that I first learned back in 1997, when I was in my senior year at National College, was this concept of the functional hierarchy. We're all presented with tons of information about what might be going on, what systems of the body might be out of balance. One of the problems is how do we pull it all together to put it into an organized system? Well, I look at the body through the lenses of 13 functional body systems. This is a way of looking at the body and start organizing our thought processes about the body and its interconnected systems. This is not about reducing the body to a series of discrete parts. Nothing could be further from the truth. What I'm advocating for is a thorough understanding of these body systems and how they interconnect, because dysfunction in one is ultimately going to have an impact on other systems. So we need to really understand the physiology of the body. So I'm a huge advocate of functional physiology, really understanding how did the body evolve to function. So I advocate using functional blood chemistry analysis to gather important information on which functional system is out of balance, so we can start bringing that system back to optimal health and wellness. So these are the 13 body systems, and these are organized in somewhat of a functional hierarchy. Doesn't mean that the gastrointestinal system is much more important than the kidneys. What it means is that if you're going to be looking at the body, if you deal with things at the GI and the gallbladder and the liver level and blood sugar dysregulation level, you might find that some of these other systems start to clean up as well. So these help us look at these various different organ systems. And I think probably just by looking at them, you can probably start thinking of some of the dysfunctions that exist within these systems. For instance, by looking at the organs of the GI, that can help look at dysfunctions in digestion, in absorption, in the mucosal barrier. We could look at conditions such as hyperchlorhydria, gastric inflammation, or its colleague gastritis. We can look at parasites, we can look at pancreatic insufficiency, we can look at dysbiosis, we can look at leaky gut. So those are just some of the things that we'd be looking at through the lens of functional blood chemistry analysis to help us uncover why there might be dysfunction in the GI. Then we have 7 accessory systems. These are more than just body systems. We take a look at blood results and we use the analysis of biomarkers to help assess for levels of dysfunction in 7 accessory systems. We can look at acid-base balance. We look at anion gap. We look at CO2. We look at sodium. We look at potassium and that type of thing. Clearly, there's some great biomarkers for inflammation, high sensitivity C-reactive protein, CRP, fibrinogen, homocysteine, uric acid, vitamin D levels, and we can go on. Heavy metals and toxicity, we're not necessarily measuring actual heavy metals or actual toxins, but what happens is when we have a body burden of these things, they can actually start altering biomarker values. So we look at evidence for the alteration in biomarker values, either increased or decreased above optimal ranges, and that tells us, maybe you should be focusing a little bit more. This is the gateway concept that I was talking about early, to be able to do heavy metal and toxicity testing. Clearly, we look at lipids, and also we'd be looking at lipoprotein profiles. We cover that in section 9 in our cardio section. We look at oxidative stress markers, and also we look at allergies. So together with those 13 body systems and 7 accessory systems, we have 20 functional systems around which we can organize our findings. We also have the ability to assess and evaluate macronutrients as well as micronutrients. So here are some of the areas of macronutrient status that we look at. We look at minerals and vitamins, and this lends themselves to looking at deficiencies as well. We look at deficiencies in vitamin D, iron, molybdenum, magnesium, calcium, zinc, folate, B6, that type of thing. We can also look at hydration status, very, very important to look at the status of dehydration in the body. We look at electrolyte status, how are the electrolytes balanced? And then we look at the macronutrients, carbohydrates, fat, and proteins. Now that we're familiar with all these, let's talk a little bit about implementation. You know, when I first went into practice back in 1998, I remember sitting in the clinic and I really used to reinvent the wheel each time a patient came into my office. I would sit and listen to the patient for about 45 minutes. We were trained to do a really good long history. So I'd sit and I'd take copious notes. And then after the session, I'd look at those notes and I wonder, what do I do next? Do I do a PE? Should I run a chem screen, a CBC? Should I do a stool analysis? Should I do this? Should I do that? Did I ask all the right questions? What protocol am I going to choose as my treatment? And it really took me a while to put together a system of evaluation that really took the guesswork out of my new and also my follow-up consults. And one of the areas I changed was I instituted ordering a blood test on each and every patient before they came to the office. Now, you might be thinking that's a little bit odd. What if they don't need a blood test? Well, I'm going to be really quite blunt here. You may want to take out a piece of paper. If you're just going to write one thing down tonight, this is it. Every new patient that books an appointment in your office needs a blood test. So if that's the case, why not get it done before they come in and see you, so you already have an idea of what's going on with the patient prior to their first appointment. There's nothing actually more exciting than sitting down with a patient that you've never actually met face to face. You've got a blood test that you've analyzed, especially if you run it through my software with a 56-page functional health report. You know a lot about that patient. And if you also do it with a nutritional assessment question, I'll talk about that in a few minutes, you've got a 1-2 punch that's really, really effective. And nothing's more impressive to the patient than you actually telling them a little bit about what's going on with them. So one of the issues is that there's a number of common problems that doctors are facing. So here are 4 common problems. Most practitioners are actually spending too much time asking questions. Most practitioners don't know what to do with all the information they gather. Most practitioners never look at the initial history again. They lose a wonderful opportunity to track change over time. Most practitioners are using symptoms as their primary means of tracking progress. So one of the very first tools, I said I would mention the assessment questionnaire. One of the first tools I implemented into my practice to go along with blood testing was a thorough health assessment question. Now, I started working with the nutritional assessment questionnaire back in 1999, working with Greg Ray Graham and Biotics Research Northwest Nutritional Therapy Association that I was involved with at the time. I helped write the Signs and Symptoms book, the Functional Signs and Symptoms book that actually analyzes each of these questions. But this is an amazing opportunity to gather 300 answers to 322 questions on one piece of paper. So I gave this health appraisal questionnaire to every new patient in their new packet of information. So my expectation was that they'd get a blood test before they came to the office, and they'd also fill this out and get it back to us. So the NAQ, as I said earlier, along with functional blood chemistry analysis, is really a two-headed monster in your clinic. So health assessment questionnaire, like I said, help you track symptoms over time, really helps encourage patient compliance. You know, there's often times when patients have got really severe headaches or have severe symptoms that they've had for a while, and just the sheer fact that they have them is a real annoyance. And so, you know, when you say, are you still having headaches? They go, yeah, I'm having headaches. Well, when they fill out a questionnaire like the NAQ, we ask not only are you having headaches, but how severe are they and how often are you having them? So you can sit down with someone and go, you know what, when you first came into the clinic, you were a 3, which is I'm having a very severe headache and it's happening many times across a month. Now you're down to a 2. Means they're still quite severe, but they're not happening quite as often. That to me is progress. So these are ways that you can help encourage compliance by using a questionnaire like this. Charting progress, you can see a change over time, as I've said before. And you can use questionnaires to allow you to assess symptom burdens of a particular system of the body, much the same way that we talked about those 13 body systems. Well, the questionnaire is organized in very similar ways. So that's a little segue to talking about functional blood chemistry analysis. So I'm going to talk now about my very favorite functional assessment tool, blood chemistry and CBC analysis from a functional perspective. I can't emphasize this enough. This technique can make such a huge difference in your diagnostic skills. So here's what you need to know. Blood testing is one of the most important functional diagnostic medicine tools for the identification of disorders and disease prevention. The human blood is a walking library of information. It tells us about what happened before, what's happened in the past, what's happening right now, and with this functional approach can help you look into the future as well. It's not simply a part of disease or injury management the way that it is used in the hands of allopathic physicians. It is a vital component of a comprehensive functional medicine workup and a vital component of comprehensive health promotion and disease prevention. Using functional analysis of a regular targeted blood test helps detect early stages of dysfunction. What better tool do we have to be able to assess for early stages of dysfunction and the early detection of chronic conditions related to almost every system of the body? Functional blood chemistry analysis is really the ultimate functional medicine screening test. It improves decision making. It reduces uncertainty. It provides objective data. Nothing's more objective than your blood. Your blood does not lie. It confirms thoughts made in the initial intake and in your history. It guides therapy decisions. It allows you to modify your therapy based upon repeat testing. It helps assess for the efficacy of treatment protocols. If you're doing a lot of work to try and help correct a dysfunction in the thyroid and it's not working, well, you can see it very clearly in front of you. And it helps both you and your patient assess their progress. One of the problems, though, is that we have this whole concept of normal reference ranges. So I want to spend a little bit of time kind of looking at the difference between the normal reference range or the standard range. And that's kind of the standard approach of how we do this. And I'm going to juxtapose it against the functional approach. So if you've already heard this, bear with me. It's something that I like to repeat. Every time that we go through this, you might be picking up a little bit more. But ultimately, this is kind of why we don't look at just the standard reference range. So the conventional standard or normal reference ranges are based on a Gaussian distribution of a bell curve. It says that 95% of a tested population are going to be normal. So you can see on this diagram here that 2.5% are going to be abnormally low and 2.5% are going to be abnormal high. And so everybody else is going to fall within this quote-unquote normal range and are going to be considered healthy. The normal range is based on statistics and not on whether a value represents good health or function. And this is a funny thing because we're asked all the time, where do you get your optimal ranges from? What is all this about optimal ranges? Well, if you actually one of the great things you can do is actually return a question with a question by going, well, tell me where your normal ranges come from. If you're looking at Quest and LabCorp or any of the other labs, where are they getting their ranges from? There is no research that's being done. It's all done on a basis that says 95% of the tested population are going to fall within the normal. So the normal range is based on statistics and not whether a certain value represents good health or function. Normal ranges are designed to identify and diagnose disease states, tissue changes, and pathology. So when an allopathic physician reviews these, their only concern is whether a particular result is outside the normal lab range. The normal reference ranges also tend to change. If you can imagine 10 years ago, the patient population that was being tested may not have been as obese or have as much heart disease or as much fatty liver as we do now. But we still have to put 95% of the tested population normal. So those results start to change every year. They get wider and wider and wider. Sometimes they go the opposite way. Sometimes, looking at diabetes and things, they've kind of pulled their head out of the ground and go, oh, actually, maybe having a lower blood glucose is a good thing. But that's not often the case. They also can change from geography. I could have a test done in Boston, and then I could get on a plane and I could fly to LA and I could get my test done in LA within, an 8-hour period, all done in the same day. And I could probably compare the results of the two different labs, and I bet you there's going to be differences in the normal reference ranges. So this leaves a large number of people falling in the range considered normal. Now, I know from a fact that when patients come and see us in our clinics, they're not normal. These people have some medical issues that we need to uncover and find out. So the problem is that normal reference ranges usually represents quote unquote an average population rather than the optimal levels required to maintain good health. Normal does not mean optimal, and clearly most normal reference ranges are really far too broad to adequately detect health problems before they become pathology and are not useful for detecting dysfunction. You can kind of sense I get on a little bit of a bandwagon on this one. So this is why I prefer a functional approach, right? A functional approach is oriented around changes in physiology. That's why I'm a big student of physiology. We're not looking at normal populations. This results in what we call tighter functional physiological ranges. And this allows us to evaluate this area that's still within quote unquote the normal, but outside of the physiological functional range. And this tells us a lot. This tells me that there's something not quite right in the physiological system associated with any particular biomarker. So we're really able to increase our ability to detect patients with changes in physiological function. So we can identify factors that are obstructing patients from achieving optimal physiological, biochemical, and functioning in their body. Some of the other points is we like to look for patterns between biomarkers and to look at trends in biomarkers over time. Almost every physician looks at just specific biomarkers in isolation from one another, and definitely not through the lens of functional body systems, accessories, macronutrients, and deficiencies. The trends and patterns between the tests provide important clues to the underlying dysfunction and an understanding of the potential cause. If you're going to take my Functional Blood Chemistry Mastery training program, you're going to learn to recognize many, many key metabolic trends and patterns in chemistry screen and CBC panels. I think one of the other important things to remember is that none of the ranges or patterns presented today are absolute. They should be viewed as what I call prognostic guidelines. Now, let's go through a sample case. So this is Jane Doe. She's a 52-year-old female. And I'm going to jump in right now to see if I can actually change a few things. So I want to approach this as if this blood test came into the office. You don't necessarily know functional blood chemistry analysis. So let's look and see if the normal reference ranges are actually going to be able to provide us any information. Hopefully everybody can see this. So we've got Jane Doe, she's a 52-year-old female. I took all of her identifying details out of here. So for those of you that are probably used to looking at these things, we have our test names on the left, we have the range and the value, and then we also have, if something's out of value, we'll have like a little blue number. We look at the reference range. And so it's a long list of biomarkers. So on this particular page, there is nothing here that is outside of normal. The ALT is a little bit elevated at 35. Everything else looks just fine. So let's keep going through here and see if we can see anything else going on. This is page 2. everything looks pretty darn good as far as I can see. So if I was her allopath, I would go, yeah, everything looks great. Nothing, no problems here. And absolutely no problems here. So there's only one value that is outside of the standard reference range, and that's ALT. And it's not hugely outside of the value. The reference range is 6 to 29 units per liter. So if this was our patient, then this was the only way that we had to be able to look at what was going on. This patient probably spent $150, $200 maybe on this test. And really, if we're just looking at it through the lens of normal standard ranges, there's not much we can do. So I ran this through our software, and I'm going to show you our new core interactive report. So if you haven't seen this report, this is a really nice looking report, and it tells you a little bit more about what's going on. So here's the report itself. This is the ODX core report, and this is a practitioner report done for Jane Doe. She was 52 years old, and that's me, the ordering physician. This is interactive, so I'm going to click this little link here, and boom, it takes me straight to the intro page. I have an introduction, I have assessment section, I have an analysis section, I have a health improvement plan, and then I have an appendix. So we have a little article here about what functional blood chemistry analysis is. Very helpful for the patient to be able to read that. But I'm going to jump in right away. I'm going to look at functional body systems. So remember, we only had one value that was outside of the normal range. But if we look at it through the lens of functional blood chemistry analysis, we're now starting to pick up a few things. There's actually some hidden issues in her sex hormone system. There's also some hidden issues in her red blood cell function, her adrenal function, her liver function, and also in blood sugar regulation. None of that was caught by the standard approach. Now, I want to take a look and go, okay, so what in her sex hormone function are we looking at? So I can click that and jump right into here. So her DHEA was below optimal, her estradiol was below optimal, her total testosterone was below optimal, and so was her progesterone. So there's some things going on there. Let's take a look back. Her red cell function, let's take a look at that. So her RBC count was low, her hemoglobin was low, her hematocrit was low, and her MCV was high. Ooh, that's slightly anemic. Not clinically anemic in the case of allopathic physicians, but there's something going on here. She's probably got a nutritional deficiency that's causing her red blood cell function to be a bit off. Adrenal function, let's take a look at that. Her potassium was low, sodium potassium ratio was elevated, her glucose was down, her cholesterol was a little bit high, her triglycerides were low, and her DHEA sulfate was a bit low. That to me is like, maybe some stuff going on in her adrenals. Her liver function, even though her ALT was the only thing that was outside of quote-unquote normal, there's also some other things going on that we want to pay attention to. Her AST was a little bit above optimal. Triglycerides were a bit low. Her serum iron was a bit elevated. Her ferritin was a bit elevated. And her bilirubin was a bit elevated, as was her MCV. Let's go take a look at accessory systems. She's definitely got some markers for allergies, but everything else seems to be okay. Macronutrients, everything seems to be kind of operating within the optimal realm, less likely to have dysfunction in those areas. Some nutrient deficiencies, definitely needs DHEA. There's a mild zinc need and potentially a vitamin B12 need. What's ended up happening here is this is sort of an index of vitamins and minerals. So even though she's got some ones that are definitely needed, there are ones that aren't needed. So it kind of pulls back the score a little bit. And let's take a look at clinical dysfunctions. And we're looking at through the lens of these sex hormone functions, red blood cells, and that type of thing. So intestinal parasites are pretty high. The reason for that is that her eosinophils are high. She's had some low hemoglobin levels. Hematocrits are a bit low. Monocytes are a bit high. So that's kind of a pattern that might be some intestinal issues going on for her. Definitely has an anemia, so we need to find out what kind of anemia. She's got iron overload, so it's probably not iron deficiency anemia. It's probably vitamin B12. So we can actually go back and go, yeah, there's definitely some issues here with B12 that she needs to look at. Some fatty liver issues potentially going on, definitely some liver dysfunction, maybe some muscle atrophy or muscle breakdown. So let's see why. Well, the AST is elevated and ALT is elevated. These liver enzymes are actually part in muscle tissue as well. So if we get increased levels of these ALT and AST, can also be part of a muscle atrophy as well. And I hope you're noticing I'm bouncing around here and taking, jumping and seeing what's going on. There's some adrenal stress here. So her potassium was low, her sodium potassium ratio was elevated, her triglycerides were low. Let's go take a look at the actual blood test results themselves. So we can take a look at, we ran 67 biomarkers, 36 of them were optimal, 13 were above optimal, 14 were below optimal. She had one below standard. And because we use an aggregation of standard ranges, she actually had 3 that were slightly above standard, but she has no alarm ranges. We can also jump into specific areas of the blood test results themselves. Given that she had some issues with hormones, let's just jump into the hormone section. So you can see below optimal on pretty much all of the hormones. So nothing below standard was going to jump out and make the doctor go, oh yeah, you've got some real issues here. But when we're looking under the hood, we can see there's some issues happening here. So tying these in potentially with the symptoms that this patient has been having. Let's scroll through this just a little bit. This kind of gives you a nice traffic lighting view of what's going on. And one of the nice things you can do for a patient if you're going to be sharing this, you see there's this area here. This is actually hyperlinked right into the out of optimum range report, so you don't necessarily have to spend a lot of time talking to your patient about what every biomarker means. This one was out of range low, 4.2, and the phosphorus level there. We also have a way of being able to look at them in comparison to one another. Obviously, she didn't have a test in the system before, but if she did, it would be on the left here, and we could see if there was change and whether there was improvement or not. Then we go blood test score report, and that type of thing. So basically, from this, we can see that when we look deeper and when we look for hidden causes of what might be going on, there's actually quite a bit for this patient that we would want to work with. So I want to take a look at some of the main role of functional blood chemistry analysis in your clinic. It's really about the prevention of disease and dysfunction. It's about the early detection of disease and dysfunction and advanced patient-specific treatment techniques. Treatments have to address the underlying cause, respect biochemical individuality, focus on restoring physiological function, and cause no harm to the patient. What are the benefits of functional blood chemistry analysis to your patient? Improving their quality of health, because you're focused on them and not their disease. You're going to reduce costs because you're not going to be spending tons and tons of money doing a lot of outsourced testing. You're going to reduce their suffering because you can identify things long before they emerge as pain and inflammation. You're going to increase likelihood of a cure, and you're going to reduce incidence of premature aging, mortality, and morbidity. But successful implementation of functional blood chemistry requires knowledge. You have to have knowledge to know what you're looking at, and you have to be able to apply that knowledge in a thinking process that works. Functional blood chemistry also requires a system. We know that experience in the business world has shown that businesses that operate using a systems approach are far more successful than those that don't. I'm a big fan of systems, and the first person to really show me an organized system was Michael Gerber in his E-Myth Revisited. Systems approach to the business of healing and medicine allow you to work on your business rather than focusing all of your energy working in your business. So applying the knowledge of blood chemistry in a system is a key to success. We also need tools. In order for a system to be streamlined, you must have the tools on hand to quickly, efficiently, and easily do your job. And that's really why I'm putting together my Functional Blood Chemistry Analysis Mastery program. I not only teach you the knowledge, but also give you the access to my software program that generates that functional health report, which is the ultimate tool for any practitioner succeeding with this particular methodology. So knowledge plus tools plus systems equals success. So what do I mean by that? Well, in the past, I've focused on providing the very best in training material. And I've done that through online training and my books and in webinars and things like that. It's really about imparting knowledge to you in the hope that you can take that knowledge and apply it in practice. But it's clear that people needed more than just knowledge. So back in 2012, I created my BloodChem software program. It generates that comprehensive functional health report. I consider this to be the ultimate tool. So I'm now combining the very best in online education and the very latest in analytical software into an amazing system for creating long-lasting change in your patient's health and well-being. And I'm calling it the Functional Blood Chemistry Analysis Mastery Certification Training Program. So it kind of gives you a little picture of the inside of the training program. This is where the knowledge and tools come together in a powerful training system. I'm going to take just a few moments to kind of go over there and show you kind of what that looks like. This is the inside of the ODX Academy, and I'm going to show you kind of what the course looks like. So when you're in here, we've got all of the course available in certain sections that are available right away. This is the certification training. We also have just the training only, if that's what you're interested in, and you don't want to be certified, so you won't get access to these live coaching calls. There are 2 modules that are available right away. I have my intro to blood testing and I have GI function. And this is basically how we split things up. We do a little functional overview. I'm going to do some kind of functional physiology or looking at dysfunctions. Then I'm going to do my GI biomarkers. I'm going to go through all the biomarkers and talk about them and why they are the way they are. And then we go into the dysfunctions. And then for those of you in certification, we have a little quiz. So, and this gives you a sense of what's coming up. We've got liver and gallbladder. We have red cell function looking at nutritional anemias. Then we have nutrient deficiencies. We're going to be looking at minerals, vitamins, essential fatty acids. We look at calcium and parathyroid, zinc, phosphorus, and magnesium, and vitamin D, et cetera, et cetera. Then we're going to do blood sugar regulation, adrenals and kidneys. Then we're going to do thyroid. Then we'll do cardiovascular and inflammation. Then we'll do sex hormone and prostates, and then the immune system, and finally putting it all together. We have some other resources. We have some bonus lectures and things like that. But ultimately, that's the training program. So that's being run out of the ODX Academy. So the Master Experience, we do 12 online training sessions. We cover 13 body systems, 7 accessory systems, the macronutrient systems and nutrient deficiencies. We talk about functional physiology. We do know your biomarkers. I'm presuming I'm going to be covering probably 85 to 100 biomarkers when all is said and done. And then we're going to do functional blood chemistry analysis and looking at clinical dysfunctions. You're going to get lifetime access to the training program. So if any of you are listening to this and you've taken my blood chemistry trainings in the past, you're actually going to get free access to this. So don't buy it. I'm going to give it to you. And this means that if you buy it today and in 2 years' time, you might be on another webinar with me, doing another registration, you get free access. If I do upgrades and updates, I don't want you to have to keep paying for the same program. So that's nice. I want to build a family of people, a real tribe of functional blood chemistry analysis specialists. And so my invitation is come and join me. You can pay some money today, but you're going to get lifetime access to this, and that's kind of nice. You get all the audio downloads, you get PDF downloads, you get bonus trainings. For those of you in the certification track, you're going to get 4 live coaching calls with me. I don't do coaching calls very often, so this is a great opportunity to get live on a call with me. And then you're eligible to sit for your functional blood chemistry analysis certification as well. So I'll talk a little bit about certification in a few minutes. So that's the training or the knowledge portion. Let's take a look at now at the tools portion. The second part of the training is the software. So with your registration, you're going to get 3 months of unlimited software for free. If for some reason you're already a software subscriber, don't buy the program today. I'm going to be giving you a coupon because you're already using the software. You're already on a subscription. So I'm going to give you a little bit of a discount. But for those of you that are coming in right now, you get 3 months of pro use. That's $525. It's going to give you enough time to enter hopefully a ton of data, integrate with Ultra Lab Tests, our lab partner. So any tests run through them are automatically imported, meaning you don't have to do manual analysis. You're going to generate some ports, add some lab tests, hopefully do a ton of consultations. I really want you to use this program. Let's go take a quick peek at the software. I don't want to take up a huge amount of time because we're all busy. So basically, this is the software. This is where you would land. We've got blood reference guides, we've got clinical conditions guides. We do lab test converters. You can manage plugins. This is where you would manage your lab integrations and then what supplement companies you want to get reports with. You can add new lab tests, add new patients, generate reports, view your patients. This is the patient list. Kind of like it because you can actually tell when the last lab test was done. So this, if I was running a clinic here, I'd be going, geez, I haven't done blood tests for a ton of time on these people. So this is money being left over here. It's 300 days since this person had a blood test, 120 days. So this is a great way of being able to go through your database and going, geez, it's like 19 people that I haven't seen for over 120 days. Let's get them back in. That's money on the table. When you go into someone's record here, and this will be changing. We're doing a user interface overhaul, so we're going to make this actually even better. But these are like little snapshots, little history snapshots. You can kind of scroll through and see what's going on. These are hyperlinked into my blood reference guide, so you can see all the different values here. This goes way beyond my book. So instead of kind of keep reissuing my book, I've actually poured most of my attention into the software and increasing this. Let's quick look at the report center. You basically select a patient, select what blood test you want to look at, And then you can either run the core report, that's the interactive report, or you can go to Classic. And Classic is on screen initially. You can see it's very linear. Still uses a lot of the same colors, but I can't jump around. I can't go, oh, let's take a look at the out of optimum range report. So this goes on and on and on. And so I do all of my in-core reports here. So that's the report center in Classic. Now that we're going over to core. You can change some issues and settings and practice administration, tons of things you can do. We've got training videos. You can see little videos that are on the training here. So basically the software, the purpose behind it is log in, add a patient, add a blood test, run a report, print a report, do a report of findings, and then rinse and repeat, and just keep doing that with your patients. So you're going to get access to you're going to get 3 months of access to this program with the software. So ultimately, I think that the Blood Chemistry Mastery Certification Training Program provides you with everything that you'll need to be successful. The clinical knowledge, amazing tool to apply that knowledge so you and your patients can save time and money and get results fast. Plus the opportunity to get certified if that's something that you really want to do. Who would benefit from the certification training? Well, the training program is for you if you want to dramatically and immediately increase your diagnostic abilities by analyzing patients' blood tests in a more holistic and functional way. If you want to be able to do what I was doing with that type of report in a GoToMeeting or a Skype consultation session with a client that's outside of your state, there's nothing better than the report that's generated from the software for that. Doesn't matter what type of clinic you have, whether you're inpatient clinic or if you're doing consultations, like I said. It's perfect for chiropractic physicians, naturopathic physicians like myself, medical doctors, osteopaths, nurse practitioners, nutritionists, dietitians, licensed acupuncturists, any of those practitioners. But for anyone with a background in the health sciences who wants to learn a system of blood chemistry and CBC interpretation that works. Why should you get certified? Well, over the years, our web presence has grown. You have to think I've been in this field for 18 plus years, and I've been on the web since 2002. So I've got quite a reputation out there, and unfortunately, I don't have the time to take care of everybody. And so as our web presence has grown, we're getting inquiries from people all over the world who are asking me to connect to practitioners that have been trained in my work and are using the ODX analytical and reporting software. They've seen one of the amazing functional health reports of a friend or a cousin or something, and they want someone to help them get the same level of information from their blood tests. So in order to refer these people to you, we need to make sure that you've been through a course of education and have been trained in my work, hence the certification. So really, ultimately, getting certified is a way for us at ODX and me to feel totally comfortable making referrals to your practice. And ultimately, you're going to be part of a growing global tribe of FBCA specialists. So FBCA in this situation is standing for Functional Blood Chemistry Analyst. We want to help get you, your work, and your clinic out in front of thousands of people looking for practitioners that can help provide meaning to the massive healthcare data that they have available to them. So being part of the ODX Academy, being part of the ODX software program, being part of the mastery training, getting this certification, it's all about helping to build this tribe of like-minded practitioners that can go out and make a difference in the world. If you think about it, if every one of you was seeing 10 patients a week, and I was training 1,000 of you, that's 10,000 patients that are being helped with this work on a weekly basis. It's very, very powerful. So if you want to enhance your clinical offerings, if you want to learn the latest and greatest techniques and strategies that actually work to get more assessment information from the tests you're already using, if you want to expand your current assessment and diagnostic offerings, if you want to distance yourself from the practitioner down the street, you want to start increasing your clinic income, because believe it or not, that functional health report that you just saw me go through, I know practitioners that are charging $500 for the blood test and a functional health report and an hour consultation and a repeat blood test, and you could charge $1,000 for something like that. It is extraordinarily valuable. So if that's the case, then the certification program is for you. So by now, you're probably wondering what the cost of all of this is. Firstly, this is a 100% online course. And remember, you get full lifetime access. Like I said, if any of you are on this call watching this video and you already have access to Blood Chemistry University, which is my old training site, don't buy the program. I'm going to give you free access. If you're a software user right now, don't buy the program tonight. I'm going to give you a coupon for refunding you for the cost of the blood chemistry software. So what does this mean? It means that as long as the course is up on the internet and available for sale, you're going to get continued access to it. This means if I update the training program, if I add a few more modules, if I make a few more changes, you're going to get continued access. Secondly, we have 2 tracks. We have training or training and certification. So the cost for training only is those of you that you're interested in just getting the training. So that's no Q&A coaching calls, that's no certification, no examinations, none of that. The cost is a one-time payment of $9.97 or 3 monthly payments of $3.75. So here's a little reminder of what you get. These 12 core training modules, you get lifetime access, you get audio and PDF downloads, you get the bonus training from leading functional medicine experts, and you also get that free 3-month professional blood chem software account. And it all comes with a 30-day free look policy. You try it out for 30 days. It means you even get a free month of blood chem use. If at the end of that you're thinking, Dr. Weatherby doesn't know what he's talking about, or this isn't really for me, just get back in touch with us and we'll issue a refund. I don't want you to buy something that you're not interested in. So that's my guarantee for you. If you don't like it, give us an email and we'll refund you. For those of you that want to get certified in this work and join a growing tribe of functional blood chemistry and analysts, then for the first time, this is actually the very first time in 18 years that I'm offering a certification. The cost for training and certification is a one-time payment of $14.97 or 3 monthly payments of $5.25. This gives you everything I just talked about. And then also for functional blood chemistry analysis certification, you get 4 live Q&A coaching calls, you get 11 review quizzes, you get the final certification examination. I also would like you to do a case study presentation. I want you to actually work for this thing. And we'll also do a face-to-face Skype meeting post-training where you and I'll sit down for 5-10 minutes to go, hey, how was it? Is this something that you really want to do? We'll give you a printable certificate, and as long as you maintain an active software subscription, we'll continue to put you on our directory, because ultimately this is about putting patients in front of you that want access to the functional health reports and that type of thing. Remember, we're expanding our outreach. We want certified practitioners that are using the software to refer people to. We'll help get you and your work in your clinic out there in front of people. So if you're interested, register now. You can go over to bloodchemistrytraining.com, get signed up. Remember, there are 2 options for you. Registration is open right now. I look forward to seeing you on the inside and helping you to provide this amazing skill to you and your practice. I'm Dr. Dicken Weatherby. Good night, and go save some lives.